Dr. Tauber, can you please tell us a little bit about the clinical success that you've had with the implantable miniature telescope?
So the clinical success is based on years of waiting for this device to become approved, so that we knew going into the surgery that there was excellent data coming through. And that is something that is very comfortable as a surgeon the night before when you do something that is relatively radical surgery for this. If you think historically what we did for macular degeneration patients, we said really there's not much, and doing a cataract isn't going to be helpful. So when you're armed with good data and you know that the work done has been FDA approved and really been thought through, the night before surgery you say, I'm going to take this cataract out, and we should expect, based on the testing we've done, an improvement. So my first case, we did the surgery. It was challenging in the beginning. It was exactly what they told us. We'd have to really use the top 5% of our brain and our skills, and that's rewarding for me. But as we're sewing the eye closed, the patient is starting to move their eye and getting a little bit antsy. And I was, what's going on? She's like, well, I'm starting to see things. And just to calm her down, I said, what would you like to see afterwards? And she says, I never saw a music video. I always want to see MTV, which is really kind of an interesting discussion. She is a retired nurse, and the next day she came in, and really the independence you saw in the way she handled herself in the clinic, the way she handled herself, the posture was something that was taken away. She was hunched over, she was very protective before. Here she realized she was a retired, Red Cross nurse, and she deserved that level of respect to carry it. A couple of months later, she goes, hey, I'm going back home. I'm like, you live in Vermont and we're in Missouri. She goes, yeah, I'm going to fly. I have 3 connections, but I want to bring you home some maple syrup. Are you going to be back there to pick it up? So she went to her family's farm and tapped a tree and brought me real maple syrup. So that experience to me is that we've taken a woman who's given her whole life to help others. The disease took away her independence, took away her sense of being. She came in, rolled shoulders, really, the darkness was her personality as well. And she came out of this with functional vision. She was motivated. She really had the support of the whole team. There were setbacks that were handled beautifully well, and really gave us the confidence to do the next patient and the next patient. And so we're now starting to see an opportunity to help these patients come forward. The screening is much more of a positive experience because we feel, yes, this can be good. The screening, finding which patient's appropriate, working with retina to identify these patients. We've now developed a very streamlined template for this to come through the clinic. It's rewarding for the surgeon, obviously, to help a patient, rewarding for the staff. When you realize that all your nurses think that they were that part, they could be this woman. And when she comes back, and every time she comes to see us, we would make her go down to the OR and visit the OR nurses. And it really is a special day. We actually put more time in the clinic just to spend time with her, just to soak in that joy.